Well, today at the Dumfries and Galloway Royal Infirmary, we're here to launch the guidance for this winter that we expect boards to take into account in the winter planning, but also the report from last winter. And we're really keen to highlight some of the great practice in Dumfries and Galloway. For example, around weekend discharging, they've managed to increase by 24% the number of people that are discharged on a Sunday, and that matters because it improves patient flow through the hospital during the week, and particularly at the beginning of the week. So some really good work going on here that we want to roll out in the rest of Scotland, and it's been good to be able to highlight that.
We saw about a 25% increase in the amount of weekend discharges, which was great. But even more interesting, I think, was the amount of discharges we managed quite early on a Monday morning, where all the preparatory work for that quite often complex discharge had been done by teams over the weekend, enabling us to discharge early on the Monday and therefore avoid that sort of log jam where Monday is our biggest day in terms of emergency admissions. So to avoid that log jam of both patients essentially needing to be in the same bed. So by discharging early on a Monday morning, it actually made a bigger impact than we'd anticipated in the original pilot.
Well, we're 2 months ahead of where we were last year in the planning for winter. So whether that's the guidance, whether it's the report itself from last winter, but also the state of readiness with boards' preparations and their plans, we're all ahead of where we were last year, and we expect boards to be publishing their plans by the end of October. So everything that can be done to put as much resilience into the plans and into our hospitals come winter is being done, and I'm very pleased to be here in Dumfries to hear the work that's going on locally.